are making some progress. I think it's progress enough that the governor put his proposal in writing and actually in bill form so that people can evaluate it, people can be thoughtful about his proposal, and people can take a good, hard look at it. I think that's very positive. I think that helps enhance the debate. I think it adds fuel to the conversation, positive fuel, alternative fuel. And I think that at the same time, we have some pretty significant differences. Employers, I believe, have to pay their fair share of the cost of health care. And I've been spending a lot of time with the governor on this. He says he's at 4%, and then he moved in his proposal. Now some employers pay 0. Several of them pay, 4%, and a lot of them pay 2%. So the funds that generates to pay for the cost of health care is a lot less than what our 7.5% pays. Our 7.5% pays close to $6 billion, about $5.75 billion. Is that right, Sumi? And so the governor's is under $2 billion. And the question here is not just the financing, it's what shall the obligation of employers be with respect to the percentage or the health care costs of their employees. On the average, it's 13.5%. 13.5%. And I mean, Dan, you're a numbers guy. We're asking for 7.5%. That's lower than what the average is. Because when you total what people actually pay, those that do, that are responsible, good government, good corporate citizens, and those that don't, some of them are also good corporate citizens. They probably can't afford to under their current business model, especially real small businesses. And you compare that overall with those that don't pay and those that do, it lands somewhere around 7.5% to 8%. So we took the number 7.5% as a compromise. I'm not going to go from 7.5% and look at the governor's 4%, my 7.5%, and say, okay, let's meet halfway. That's not the way we're negotiating this. You cannot let employers off the hook. They have an obligation to be part of the solution here. I want to make sure that people don't have to pay more than 5% out of their pocket for prescription drugs, out-of-pocket expenses, and premiums. Governor says, no way, the system can't withstand that. I said, then how can we, from a public policy standpoint, responsibly require people to have health care insurance if everybody cannot afford it?